Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, after almost 2 weeks away from the public eye, President Rodrigo Duterte addresses the nation amid speculations over his health. It's the second day of the modified enhanced community quarantine in the NCR Plus Bubble, but health authorities warn we're not out of the woods yet, despite the more relaxed quarantine status. And with high numbers of COVID-19 cases, deaths, and hospitals remain full, is it high time to abolish the government's Interagency Task Force, or IATF, for its COVID-19 response? Senator Imee joins us live. President Rodrigo Duterte denies speculations that he is sick as he made his first public appearance after 13 days. The president showed up during his public address in Malacanang Monday night. He explained why he had to cancel his regular talk to the people last week twice. Here's the president in his own words.
Ganun na ba? Pagka kinakalkal mo, I never pretended to be talagang sinadya ko yun. Ganun na ko. Pagka kinakalkal mo ako, lalo akong yung parang bata. Pagka lalo mo akong kinakantsawan, mas lalo akong gagana.
Today is the second day of the Modified Enhanced Community Quarantine, or MECQ, in the NCR Plus Bubble, but the government says it is ready to reimpose stricter lockdown measures if the need arises. We've been seeing record highs on the coronavirus pandemic in the past weeks, but the country has a grim milestone this week after recording more than 15,000 COVID-19 deaths. Let's go straight to the source of the story. We have Senator Imee. Senator Marcos, it's good to have you on the source. Maraming salamat po sa inyong oras.
Yes, magandang umaga po sa inyong lahat. Andito ako sa Ilocos, wala ako sa NCR Plus. Swerte, mas mainam pa sa probinsya. But we're happy to join you. And truly, the IATF has caused a great deal of alarm and confusion.
You already in the past, Senator, about 3 weeks ago, sinabi mo abolish the IATF. Let's just start from scratch. But obviously, this has not happened. Are you again inuulit niyo ho ba? Are you repeating this suggestion of yours?
Well, I think there are very competent men and women in the IATF. However, these are the cabinet members. I strongly suggest that they put together a complete task force rather than just hauling in all these cabinet members who, as we know, are very, very busy with full departments to run. Ang dami-dami na nilang trabaho. Sana dapat tutukan na lamang, as I've recommended from the beginning, a core group of scientists, of immunopathologists, of health and public health experts, rather than all the cabinet. And thereafter also bring in the LGUs, who after all will implement all of this, at pati na rin yung private sector na palang napipilitan pala ang bumili ng mga bakuna. So sana makumpune ang isang task force maliban pa sa IATF na sadyang tututukan and will solely and exclusively focus on the COVID response. I think there's been a unanimous verdict, not from me, on the mismanagement of our COVID response. The World Bank has already denounced the draconian measures we have undertaken without the containment benefit. Ang sabi ng IMF, laggardly or kulelat ang Pilipinas sa buong ASEAN. At yung WHO ay nananawagan that our health system is on the verge of collapse as it has passed the red line, allowing our health workers to function efficiently. So these are serious concerns, not to speak of the over 4.5 million unemployed, the almost 8 million underemployed. These are very, very serious concerns.
Senator, meron ho ba kayong nakikitang personality or individual who can lead, as you were suggesting, a new task force
I am very, very confident that Secretary Galvez is a competent and good soldier. However, I do believe that in the end, he may, as a good soldier, be taking orders from too many people. And perhaps, as I said earlier, it should be science-driven by doctors who are very, very familiar with mass vaccination and other efforts. It's a very cruel choice they're making us make between life and livelihood, when in fact there is no such choice to be made. Health always comes first. Kailangan mabakunahan muna lahat ng Pilipino, o at least yung sinasabing herd immunity, at saka lang tunay na makakabangon ang ekonomiya. Kung bakit kasi maraming nagpupunteriya at nagsasabi somebody dropped the ball, at bakit ang bagal-bagal ng rollout.
Okay, but meron ho ba kayo nakikitang posibleng pwedeng mamuno ng bagong task force? Do you have a suggestion?
Well, I'm not in the position at hindi ko naman pangungunahan ng presidente. Pero napakaraming magagaling dyan. Even within the DOH, within PhilHealth, napakarami rin sa UP na kilala natin. Yung mga dalubhasa sa PGH, lahat yan sa RITM. Lahat sila magagaling at alam nila ang trabaho nila. Kaya nagtataka ako kung bakit hindi sila nasa sentro nito. Ganon din, our governors and city mayors, particularly in NCR and Cebu, have proven time and again their innovation, their readiness to help. I think the same can be said about the private sector, who have always been at the forefront of the COVID response. Mas mabilis pa nga yung private sector. Dito lang yata sa Pilipinas, ang bakuna binibili ng mga business sector, hindi ng gobyerno. Samantalang may pera naman. Yun nga kung bakit ang bagal-bagal. I'm very deeply concerned by, eto nga, para tayong close open, patay sindi. Ano ba ito? ECQ, MECQ, pati tayo nahihilo na.
Okay, I wanted to go there, Senator, no? Kasi nga sinabi mo, you're not big on these classifications, whether it be MECQ, ECQ. You were saying that the classifications is really not what's important. Please explain that to us.
Yes, I think these are ever-changing, confusing, and perhaps it's not a question of policing these different levels of quarantine. In the end, it's really accompanying them with two things. Well, firstly, obviously, much stricter adherence. Parating sinasabing pasaway ang Pilipino, parang naiinis naman ako pag naririnig yon. Ang totohanan, we really need two things to go with any level of quarantine, any kind of ECQ. And first, we have to provide the adequate medical protocols of testing. Hanggang ngayon, konti, kakarampot pa lang ang natetest at ang hirap-hirap, ang bagal-bagal magpa-test. There's barely any contact tracing and the vaccines are still to arrive in any significant number. So yun, una, dapat may medical. Ikalawa, we should provide social protection for all who need it. Yung ayuda, the food packs. Until today, our food supply is sort of jeopardized by all these meat imports and the alleged scams. So why is the rollout so slow? Bakit napaka-anemic ng ating stimulus? Ika nga, the people who have been rendered jobless need to carry on and work. So to my mind, I think we should have the MECQ, which we have now. I think that's rational. But at the same time, let's give the LGUs the power and the right to have granular or very specific sitio, barangay, or even street lockdown.
Which is what they're actually doing, Senator. The LGUs, obviously, meron po silang karapatan at responsibilidad to do this granular lockdowns. But in your earlier statement po kasi ang sinabi nyo, puro tayo reflex action. Ano ho ba ang nakita nyo? Opo, ano yung nakikita nyong naging shortcoming ng gobyerno dito sa COVID response natin, saying that palpak yung ECQ at puro reflex action ng gobyerno?
Hindi, kasi tayo parang patay sindi. close, open. Ayan, pag tumaas, close. Pag medyo lumuwag at umaray na lahat kasi hindi nakakapaghanap buhay, biglang open na naman. Hindi po pwede yung ganyan. Dapat may konting plano. At as I've said, the ECQs need to be accompanied by medical protocols of testing and vaccination. They also have to be accompanied by ayuda, yung social protection, food packs, guaranteeing the food supply of everyone. This is very, very important. We mentioned the LGUs. The LGUs, yes, they have been calling on the granular lockdowns. But in fact, they're also hampered by ECQ kasi may mga lugar na hindi talaga pwedeng mag-transport. Hirap na hirap yung communications and transportation natin. For example, the food supply comes from the North and Central Luzon. Hindi kami nakakabenta ng gulay. Hindi makapasok sa Metro Manila. Hindi nasa ayos yung mga transport at iba-iba ang ruling ng kada LGU, iba-iba ang ruling ng IATF, NTF, LTFRB. Nakakahilo dapat sana kasi ang tagal kong naging governor. So I understand the plight of the LGUs. They've been ordered for the past year to set up isolation and quarantine. Sagad na sa buto ang kanilang mga budget. And really, it's very, very difficult because most of the budget is in national government hands.
So we need to talk about those. Definitely testing, contact tracing, and also vaccination. Senator Imee Marcos, we need to take a very short break. The Source will be right back.
Thanks.
You're watching The Source on CNN Philippines. Our guest today, Senator Imee Marcos. So let's go to the details, Senator, dun po sa testing. Ang talagang recommendation po ng mga health experts is to test about 90,000 a day. If we look at the data, and I hope we can put that up on the screen, in the past week, I think it was last Saturday that umabot tayo ng almost 41,000. So this is not even half of what health experts are recommending. Siguro ang tanong, Senator, dahil tanong nyo din po ito, bakit ho ba tayo hindi umaakyat dito sa 90,000? And as a follow-up, what should be done? How can this be increased?
Yes, that's right. Alam natin na nagbigay tayo ng budget para bumili ng testing kits. I'm very, very perplexed and puzzled by the lack of testing kits. If truth be told, the Congress and the Senate made the budgets available through Bayanihan 1, Bayanihan 2, nandyan din yung DOH budgets na 10 billion. Kaya nagtataka ako kung saan napunta lahat yon. And we are also aware the private sector donated 10 million testing kits. We should be ramping this up. Bakit ang bagal? Maswerte na nga umabot ng 41,000. Yung average natin nasa 20,000 kada araw. Samantalang ang laki ng Pilipinas, nasa 106 million na tayo. When will we ever achieve not only testing the majority of Filipinos, but even vaccinating to achieve herd immunity?
Yeah.
Ang tagal, it's very, very slow, the rollout. The contact tracing as well, papalit-palit ng app. Hindi na namin maintindihan sa probinsya how to contact trace the OFWs, the returning Ilocanos, even the ones coming from Manila. It's all become a complete confusion. And as you know, contact tracing is the key to all of this. It's totally bogged down.
So I want to go to contact tracing in a bit, but because you mentioned that meron ho talagang budget dito sa testing, what can the Senate do to look into this? Kasi ang tanong ho, magkano ho ba talaga, is it specific sa testing, magkano ho ba talagang dapat for testing? And with the budget that Congress gave, dapat ho ba yung testing should include yung tinatawag na first generation, second generation, possibly kahit po yung third generation close contacts? Kasi marami pong nalilito dito government is saying it's free. But there are others, when you see on social media, sinasabi ho nila kahit na first generation or second generation contact sila, ay hindi naman, nagbabayad pa rin daw sila.
Tama yun. Talagang magbabayad nga yung karamihan. Kasi nga, hindi ko maintindihan kung saan napunta lahat ng testing kit. May 10 billion nga na nailagay for DOH. Tapos marami ring nag-donate. Andyan din yung Red Cross na pinapasukan, pati na yung saliva test para lamang mapalawak yung mga tested population. And this has really been a matter of grave concern. It's the same story with the vaccinations. We've borrowed upwards of 140 billion for the vaccination, and yet where are the vaccines? We have vaccinated our health workers finally, thankfully, but these are donations from China. Wala pa yung mga pinamili talaga ng Pilipinas. Apparently, they're trickling in this week, next week, and I pray that once they do finally come in, we can effect a wide-ranging vaccination effort. Kaya lang nakakatawa kasi pinagpipilitan na naman na magba-vaccinate at magte-test sa ospital. Tigilan na yung ating mga ospital ang mass vaccination. Hindi para sa ospital lamang. We've seen it all over the world. All we have to do is imitate the best practices, and hospitals are geared and skilled up for taking care of sick people. Let's not mix up the very well and healthy people with those who are sick. So yung mass vaccination, hayaan po natin sa iba't ibang lugar, the stadium, the classrooms, the other RHUs, as we've seen done very efficiently in other countries.
Okay, so you jumped to vaccination. Let's talk about that. So far, we have about 3 million. And if I'm not mistaken, Senator, 1.5 million of that has been procured, yun pong Sinovac. The rest were donations, about 1 million donated by China dun sa Sinovac, and about 525,000 doon po sa AstraZeneca. In total, again, let's peg that at 3 million. How do you find the pace of, hindi lang una, yung pagbili natin ng bakuna, yun po muna, at yung pace po ng vaccination natin, dahil so far we have vaccinated about 1.1 million individuals.
Yes, that's right. Yung pagbili ng bakuna napakabagal talaga. I'm fully aware that, for example, the donations from China were offered as early as June of last year. Bakit hindi nabigyan daan? As early as November, December, we had offers from the United States of our own allocation here in the Philippines. Hindi rin nabigyan daan. There were so many offers from the private sector for them to come forward and buy their own. And yet we had this draft administrative order that was being circulated for the signature of the president, indicating that great swathes of industry would not be allowed because they were sin products. Hindi naman pwedeng iban lahat ng mga sugar, milk, na breast supplement daw, yung soft drinks kasi masama sa katawan, alcohol, yung tobacco and other sin products. I think we should try to open up and expedite all of this as quickly as possible. With regard naman to the vaccination effort, finally, we seem to have ratcheted up a bit. So sana talagang ma-accomplish yan. Nung binibilang po namin, nag-umpisa tayo sa 11,000 a day. I think we've gotten much faster, and thankfully, the LGUs have bolted in, and hopefully we can continue to support the LGUs so we can do this much quicker.
Yes.
The original computation was we would hit 3 million at the end of the year, which is very, very far away from the herd immunity of 70 million. So, paano, ilang taon yun at this rate? I am very hopeful that we can spread, as it were, the vaccines and empower the LGUs by giving them adequate budget for medical reserve corps. For example, ang dami namang volunteer nurse, ang dami namang volunteer PHW who are perfectly capable of vaccinating.
So yung 1.1 million vaccinated so far, we started vaccination March 1. So more or less, let's put it at 45 days. So 1.1 million divided by 45 days.
Yes.
Para lumalabas po, Senator, 24,000. If I'm not mistaken, yung nababakunahan in a day.
That's correct.
Kayo ho ba naniniwala dito sa, well, the plan of government and Secretary Galvez that 50 to 70 million will be inoculated by the end of the year? Do you think that's feasible?
Yes, Pinky, I am very nervous. Firstly, there are issues of supply. We know that that's not the fault of government. Talagang nagkakaubusan all over the world. Pero yung kabagalan mag-process ng FDA, yung katagalan ng DOH, yung turuan sa customs, tayo na lang masisisi doon. Sana may quick process at sana yung mga LGU, i-tax exempt na rin katulad ng private sector. I-tax exempt na yan, saka na lang yung papelada tungkol dyan. I think it's very, very important to expedite the entry of the vaccines. We haven't clarified the cold chain. For example, the freezers required, these are sub-zero, sub-Arctic temperatures that are required for Pfizer and Moderna, for example. And certainly, the far-flung provinces in Mindanao, in the islands, do not have such freezers. But why don't we look into that? Because we are already hearing from the cold chain suppliers that they're already overbooked. So these are the things that are concerns. Even the syringes, the LGUs are howling that they don't have enough syringes. And this assignment of doctors to observe post-vaccination to make certain that side effects are not serious or fatal. So
So do
these
you
are the
believe-
things that we'd like to see planning-wise. Pero tulad nga ng sabi mo, duda ako na ma-achieve natin yung 50 to 60 at the end of the year. I hope I am wrong.
Okay, then I just want to go back to what we were talking a while ago, yung contact tracing. Sabi na po ni contact tracing czar Benji Magalong na it's been deteriorating because really the ideal ratio is 1 to 37, ano po, and obviously we're not achieving that. I guess just wanted to get your personal take on this. Because there are different apps and because LGUs have implemented their own apps and tayo po, nag-aano ng QR code, pinapasok po natin yung QR code o nagpe-pen and paper contact tracing po kung saan man tayo pumunta. In this whole year of the pandemic, have you personally or know anybody who has actually been contact traced?
I know a few, but very, very few. In Ilocos, for example, we've had so much trouble with the contact tracing, despite the fact that there are so many returning Ilocanos. We've had so much trouble. There are issues of the internet. There are issues of the QR code. So many of the phones are not enabled because they're lower 3G phones, for example. And I think Mayor Magalong, Benji himself, will be the first to admit that here in Northern Luzon, it's been very difficult. And yung sinasabi na lahat ng unemployed gawing contact tracer na lamang, hindi naman ganun kasimple kasi medyo technical din yung pag-aayos ng mga apps. And it's very, very confusing. The borders are so porous or even non-existent in many places in Northern Luzon.
Senator Imee, what about hospital occupancy? I'm sure you've heard reports on social media, on television, sa online po na punuan po ang mga ospital. Of course, yesterday, sinabi na rin po ng ilang miyembro ng IATF na nagdadagdag na po sila ng mga critical beds, numbering about 164. And thousands of isolation beds and ward beds as well. So 164 ICU beds, let's put it about 3,500 additional beds for isolation and ward beds. What are your thoughts on this? And ito ho ba? Go ahead, sige po.
Yes, thanks, Pinky. Yeah, tama. Dahil totoo yan. Unang-una, this is really payback for our failure to invest in healthcare. Mulat sa poll, talaga naman kulang na kulang. Kumbaga, we only have 30% kung yung standard ng ilang beds kada population natin. Ang layo-layo natin. We have 1/3 to 1/5 of the beds required. We failed talaga to invest in hospitals and in healthcare. So we have to ratchet up and meet the 2/3 that we should have had from the very beginning. And now we are trying to build this isolation and other quarantine services. The problem really is that national government is unable to roll it out as quickly as they'd like to. So my suggestion is that they farm out many of these efforts, the tents, the isolation areas, to the LGUs and the private sector once again, because they can do it much, much more quickly. Give the funds to them. Give them also some funds to hire medical volunteers and run shuttles for medical reserve. Wala ring mga PPE. Talagang nag-iiyakan na sa orthopedic, sa lung center, na wala man lang silang mga face mask na, nagkaubusan na ng gloves, ng gowns. So this is really a huge problem. And I think there is a number, 13% of those infected are health workers here in our country. Samantalang sa ibang bansa, nasa 2% lamang. Kung hindi natin mapangalagaan ang mga nag-aalaga sa atin, sino pa mag-aalaga sa atin? This is the real issue here. We need to take better care of our health workers, bring on more volunteers on board, and start partnering them up with the LGUs and the private sector. This cannot go on.
Is there a doctor in the public health office? Yan po ang tanong ni Senator Imee Marcos. We'll ask her about that. We just need to take another short break. We'll be right back. Our source, Senator Imee Marcos. So doon po din sa press release ni Senator Imee, ang sabi nga niya, is there a doctor in the public health office? Hindi niyo ho ba nararamdaman si Secretary Duque, Senator?
Ay, nako, masakit man sabihin kasi taga Pangasinan, katabi namin, talagang hindi pa masyadong nararamdaman po. So I wish we could bring on board many other doctors who are really experts in the field. We've heard of all the RITM doctors who are doing a heroic job, the PGH doctors, all the doctors who are virtually sacrificing life and limb in UP. Let's bring them on. There's so many. I think we need the advice of everyone who's in public health and immunology.
Senator, mabilis na tanungan na lang po, thoughts on ivermectin?
Well, sana bigyan na ng emergency use permit. Kasi itong compassionate na binibigay sa ilang hospital, nagkakaroon pa ng intriga. Let's make life easy for everyone. Pwedeng emergency use, wag lang commercial. Subukan natin, 5 pesos lang at ginagamit naman dati. So let's allow this sort of thing. I think it's the duty of government and the FDA to expedite all possible treatments, all possible vaccines, so that we can safeguard our people from this dreaded disease.
At marami pong nagtataka, bakit parang si Senator Imee Marcos very vocal doon sa, let's say, pagtuligsa sa government's response dito sa COVID-19. Bakit ho? Kayo ho ba ay nagiging boses ng one kind of opposition o critical lang ho ba kayo? How would you describe that?
Hindi, ang masasabi ko kasi nasasaktan na ang tao. Kilala ko po si Presidente Duterte, kapag masakit na sa taong, talagang aalma na talaga siya. So ang tunay na kaibigan, dahil tinuturing ko ang sarili kong kaibigan na nagmamahal at tapat kay Presidente Duterte, ang tunay na kaibigan, nagsasabi ng totoo. Hindi tayo magbobolahan. Kung hindi na maganda yung nangyayari, kailangan isumbong mo. Sabihin na ninyo ako yung sumbongera, pero kailangan talaga magbago ng kaunti ang ating response.
Okay. Nakatawagin na namin sumbongera.
Sumbongera, higit sa lahat. Lumaki kasi ako sa Malacanang. Alam ko ang patakaran doon. Minsan, yung mga tao, sinasabi lang yung maganda. Alam mo na, ganun talaga yon. Huwag tayong maniniwala. There has to be a truth teller somewhere.
Last question. Overtime na po ako. Dahil nga po nagpakita na sa Pangulo kagabi, of course, on social media, nagkaroon ng trending na nasaan ang Pangulo dahil nga he did not show up for almost 2 weeks. Ano po? Which the President already explained. Kayo ho ba, frankly, nagtaka din ho ba kayo nasaan ang Pangulo that time?
Siyempre, nagtatanong tayo lahat, nasan na si Pangulo? Kasi lahat tayo talagang nakatutok sa kanya, umaasa sa kanya. At sabi nga namin, talagang loyal at mahal natin si Pangulo. Pero nako, nasan na ba siya? At isumbong natin itong palpak na ibang tauhan niya. So, eto nga, we really need him to be at the forefront of this pandemic response.
Senator Imee Marcos, ma'am, maraming salamat po sa inyong oras. Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.